that you have for your organization, and then the risk assessment. And we picked some top areas that we thought we should focus on to begin with, but we can modify that depending on individual needs of the individual group. And then the compliance hotline. It is a cooperative between us and the LPCA, and we are just really excited about doing this with this. We did this slide last month. I'm just putting it up here for you all to see it again, is that we believe that that everyone else starts with punishments, and if I've read one book, I've read 15 of them, and all of them start with the False Claims Act and then go beyond there. We just think that compliance is doing the right thing, and we think that most everybody wants to get up and do a good job and want to do the right thing every day, and so that's where we're starting with. Again, the compliance program, just the definition that we used last week. Not going to spend a lot of time on that. It's just that the main thing about the compliance plan is it provides you and your employees with tools for acting ethically and for maintaining compliance within applicable laws. I have some examples of some bad behavior here in just a little bit. The key elements of the compliance plan, and these come directly from the Office of the Inspector General, and they wrote that what they think that a small physician, a solo practitioner or a small physician group, and that link at the bottom will take you directly to that document. And the reason we're talking about these two is it is designating the compliance officer and then developing the open lines of communication. The tools for compliance. When you look at what a compliance plan is that you have to look at the fact that the compliance officer and the compliance committee, they're not enforcers. They are, in fact, they're the radar gun. They know what the speed limit is. They know what you're supposed to be doing, and then you use them to determine whether or not you are exceeding or not exceeding what you're supposed to be doing. So the enforcement is made by administration. However, the compliance officer and so forth make sure that we have all the written policies that are in, we've got the communications open, and that we have the appropriate training programs, and educational opportunities for everyone. So the compliance officer itself is a very broad job, and it requires a great deal of discipline on the fact of a compliance officer, because the compliance officer in most organizations starts out usually as having this is a different job, or it's added to. And what we always say when we walk into most places is that most of you all have full-time jobs to begin with. Now we're going to be the compliance officer. So if someone designates you as a compliance officer, and that's not your only role, is that you really have to be very disciplined, and you have to set yourself goals, and you have to set yourself timetables, and you make lists. And I'm a calendar guy. I believe in calendars and putting things on calendars, which is why we did what we did. Is that is a discipline for us, is that we know that the last Thursday of every month or the last Wednesday of every month we're going to be doing this program. And so that's the kind of discipline that we have to have. And so it's just important for you to understand, if you're chosen, is that it really takes a lot of your time, and then you have to use your time wisely. Now, one of the things I want to talk about, because I'm actually doing this somewhere else, sorry, that's a very delicate little mouse there, is that the OIG recommends that you have and designate a compliance officer. And then it says the compliance officer should function as an independent, objective person. And then down below, I just say the OIG prefers, and that's their word, that the compliance officer directly to the board and not to the CEO. Now, whenever you're dealing with the federal regulations, is that you generally have to just start with, we generally look at musts, shoulds, and wills. Musts and wills are absolute. Shoulds are not absolute. So when you look at this, it's saying we recommend that you have a designated compliance officer. It doesn't mean you will have one. The compliance function could be handled by a team and not an individual. But it recommends that. So generally speaking, when they walk in the front door, they say, who's your compliance officer? And one of the things that they don't like to hear is that it's the CEO. So then the second thing is that it should function as an independent and objective person. Now, I've seen organizations where the compliance officer reports directly to the CEO, and then in most instances, I see them as reporting directly to the board. Because remember what we're trying to do as a compliance officer. We're trying to make sure that people do the right thing, and that includes our executives. We don't want them entering into strange financial relationships with people, or receiving kickbacks from certain people, or receiving, and so therefore the compliance officer has to be able to act independently and unafraid. And the main function that the compliance officer has is to coordinate and communicate the plan. And for most of you all, if you haven't gotten a plan, is that involves planning, implementing, and monitoring the entire program. Let's just go through the duties here for a second. Now, if anybody has any questions that you have, please feel free to just put them right there, and we'll try and answer them as quickly as we can. Overseeing and monitoring the implementation of the compliance plan is, how is it going to work? Are you going to meet monthly? Who's the committee? Are you going to have an internal committee? Are you going to have a committee of the board? I have seen both, and I have seen some that have both. You have an internal compliance committee. Sometimes and frequently, because the areas that are most concerned are, you have a finance person who's in charge of the contracts and contracting, making sure they're done correctly. The human resources, because the human resources plays a big role in this. The billing and coding supervisor, because they play a large role in it, and the risk manager. And so those are 4 people or 4 functions that could be on an internal committee. And then that internal committee decides what they think needs to be important for the organization, and then they do their stuff. They carry it forward to the committee, either a committee of the board, or they carry it directly to the board. And I have seen both, where it's a committee and where it is an internal committee going to a board committee, which then goes to the board. The other duties that you have is coordinating the personnel issues with the organization's HR department, and probably the biggest thing there is making sure that nobody who works for you has been excluded or debarred from the plan. And then the financial management, internal compliance review and monitoring activities, including annual periodic reviews. And where we're looking at there is that it could be contracts, contracting. I know that most of you all have a 340B program. I don't know if you're using, if you're monitoring it yourself, or you're using another organization to monitor it, or as one of the organizations was using Walgreens, and their contract said that they were supposed to be delivering these quarterly reports, and guess what? They were not delivering the quarterly reports. So unless somebody is asking for it, it's either not done or it's just not been forwarded down. So someone has to do that. And then independently investigate anything that comes in that you're not sure with providers, agents, independent contractors. For example, is that if someone wants to use peak performance to help them set up a compliance plan, is that you need to make sure that we're doing what we're supposed to be doing and delivering what we're supposed to be delivering. If there are relationships with, if you have other outside financial relationships, making sure that those contracts are being being done correctly and on a monthly basis or on a quarterly basis or yearly basis, you would be surprised how many contracts are outdated or unsigned. What happens for the most part is that we will get a contract from an organization. We will sign and send a contract to the organization, and we never get the signed organization's copy back. So since we don't have it, is it valid? And then are we able to make them do what they're supposed to do? So those are the types of things that we're talking about there. More things. Developing policies and programs that encourage employees to report suspected fraud and other improprieties. Now, I hate the word fraud because fraud means that it is willful and contrived and you want to do it. Mistakes are not fraud, and we just said the other day that stupidity is also not fraud. If someone has been doing things the way they've been doing them since they've been trained, since they've been in there, they don't know what they're doing is wrong. So it's up to the compliance officer as well as the managers. You all sit and talk about whether or not things should or should not be done this way, and whether or not, what we should do and what we shouldn't do. And one of the examples, and my wife and I were talking about the other day, is that in Miami, they caught a young woman who was going in and taking the driving tests for other individuals, and then when it came time to take the picture for their driver's license, she would say, no, I want to get more pretty and get makeup on and so forth and take the picture, and she would leave. And then the next day, a different woman would come in and say, I'm here to take my picture. Well, when they finally caught the woman, she said, well, I didn't think there was anything wrong with me taking the test for someone. And the way they caught her was actually somebody that said, I've seen her here different times using, this, what? So those are the kinds of things that, I'm just absolutely amazed that anybody would say that, and yet it happens. So if you see things happening, is that getting people to come to the compliance officer or their manager and saying, I'm not sure that this is done correctly, or are we doing it correctly? And it should never be judgmental, and we should encourage that and not discourage that. And then developing the process to screen. Now, and look at this one. We got into a lengthy discussion about the exclusions. It says employees, physicians, independent contractors, and suppliers to ensure that they have not been debarred or excluded from participating in the federal and state healthcare programs, federal and state healthcare programs, which means all 50 states, all 4 U.S. territories, as well as the federal program. And for the most part, I'm willing to wager that we do a pretty good job about making sure that on hire that we have checked the federal databases, but I'm not sure that we have checked everything that we're supposed to be checking with the frequency. And the one that really gets to you is independent contractors, is that you have a independent contract maybe with me or with Peak Performance Physicians, and you need to make sure that none of our folks are debarred also. So, and then you look at suppliers, and we have been and you can just go all the way down as far as you want to. What about the gardener? What about the guys who pick up the trash? What about the housekeeping department? What about we have someone comes in once a year and washes the windows? It says all. And we have to decide where the risk is to go further to see what all means. The thing here, and this is where the CEOs and chief financial officers have a lot of problems, is that the compliance officer must have the authority to review all documents and other information relevant to compliance activities. Contracts, contracting, physician compensation, how are they paid? What sort of relationship do we have with Walgreens or CVS or Rexall or whoever the drugstore is that's doing your 340B program. You know, all other contracts is that, you know, my brother-in-law is the one who's in charge of maintenance. You know, well, you know, your brother-in-law may be in charge of maintenance, but he's not doing anything. So the compliance officer has to have the authority to do that. And it's really tough when you answer to the CEO and not the board to be able to ask those real tough questions and say, let me see what this looks like. It evolves over time that as the program gets started, we really start with the hot buttons, and then we start looking at some of the other hot buttons. Okay, the sample job description. I'm going to go out of this, and I think you were all sent a copy of the job description, but I want to go through the sample job description, and I think that it is right. No, it's not right here. Let me go get it very quickly. It is right. There we go. There it is. Now this one is very, it is really very, very detailed, and I like it because it was very, very detailed. But look at the first, look at this third line right here that I'm marking. It says reports to the president, CEO. And remember is that the federal government says they prefer that not, okay? And so the chief corporate compliance officer is the president and CEO, and that is exactly the first thing that the feds say we don't like. But I wanted you to see how detailed this thing is, and we thought that was a very good program. We're not casting any aspersions on it. We're just simply giving it to you all to see. These are the types of things that you have. Planning responsibilities is to develop the program with a corporate compliance plan, member organizations, systems risk management, compliance audit review, schedule delineating, your strategic objectives, corporate compliance to policies and procedures, and so forth. So we just keep going down and keep going down. Non-essential responsibilities is you get to perform other related duties. And then look at some of the qualifications that this organization was looking for. And it does not mean that this is what you have to have. There are plenty of people who are compliance officers who have a very firm grasp of the language and they know how to read. And so to me is that the one thing where it says preferred characteristics is that I would basically really strongly say whoever's in here has to have the discipline that, you know, to do everything that we can do anytime we can do it. I just ask you to look at these things, and some of them are not going to make any sense because this was for this organization. But one of the things that you should do is you should sit down and try and write your the job description for your organization and see what it looks like and what does it look like, because it really gets tough when you start looking at when you start trying to look at where you're going and what you're doing and what sort of jobs you have to have in there. So, you know, you can use, one of the things you can bruise some of these qualifications by using a corporate attorney or outside agents. And with the corporate attorney is that frequently what we do is we see people who will have their physician financial arrangements and some of their outside contracts. All of them are reviewed by corporate counsel to make sure that they meet current standards, and they should be, you know, reviewed not I'll use the term frequently, but you all should describe what that frequently is whether that's annually or semi-annual, or maybe you have a contract that's 3 to 4 years, and you might not want to review it, but for every 2 years or halfway through the organization, or halfway through the time frame. Code of conduct. The code of conduct is something which is required, recommended, that be written, is a code of conduct. And I'm pretty sure that most of you all have a code of conduct, and most of you have it written. It's in the front part of the human resources manual and so forth and so on. And you should look at that code of conduct to see whether or not it includes a statement of your ethical and compliance principles. It includes a summary of the broad ethical and legal standards under which you and your administrative and medical staff should operate and reflect your mission, vision, and values. I have seen an organization, I'm going to show you one, that actually has 4 or 5 different codes of conduct. And one of them is a code of conduct that you have when you're dealing with your guests. Then you have a code of conduct which is dealing with business partners. Then you have code of conduct when you're doing corporate outings and so forth and so on. So I have seen some, and you have an IT code of conduct, how you send emails, the language that you use in emails. A code of conduct is passwords, is that you don't use someone else's password. And I know that no one shares any passwords anywhere in your organization. And then it should be reviewed thoroughly with each employee, and then annually thereafter. It's probably really important to sit down and remind folks this is what we're supposed to do. Remember, they come to work on the first day and they learn by watching everyone else, and that becomes their code of conduct. I will give you my personal one of my personal codes of conduct. One of the things that I first went to work in a hospital that was a nonprofit hospital, and it was a county, and the administrator sat down and said, everything that's in this organization belongs to them. You don't get to use it unless they say you can. Do not use anything in this organization for your personal business. And I really never have. If I had an organization that I was working with, I had 2 cell phones. I had an organization cell phone, and I had my cell phone. I use my computer or their computer, but I don't use the 2. He recounted a tale of an administrator, a hospital administrator, who was fired because he used the company stationery to support a candidate and send it out to all of his employees and his friends and saying, we would like you to elect, to consider voting for this. Well, they fired him because they said, 1, he breached the ethical standards of we're apolitical, so we don't do that. And 2, you put us at risk by using our stationery, and now it looks like we, the hospital, are supporting this, and we, the hospital, the board, have not supported. So, I have, I have a very strong, my first job, that was what they said. It's theirs, it ain't yours. Whether it's the desk, the telephone, the paper clips, so forth. In one organization I worked in is every year in September, our paper purchases and our pencil purchases went up every year, and we could never figure out why until we realized school was starting. And all of our notepads and our pencils and some of our pens were disappearing into someone's home. Not a big deal. We just reminded everybody, don't do that. This is not yours. It is called stealing. So those are kinds of things followed and reviewed by all personnel and then updated periodically by the compliance department and the board of directors. Now, I gave this sample right here, and some of you all know and some of you all don't know, but on the weekends I get to work with Walt Disney, and this is the employee conduct that they have. Now, they also have the business. They have off campus. They have all sorts of, they have about 6 of these. But this is the one just for me as a cast member of how I'm supposed to treat you all. And it says, and this is just really simple. So even Disney has its own. And if you look at some of those things, the violation of any policy manual, the standards of business conduct, and you see if you click that, then you go to the business conduct. Conduct toward the managers, co-workers, anyone comes in contact while performing for the company that is unprofessional, discourteous, and disrespectful. Disregard for any safety rule or procedure, any act of theft, dishonesty, or falsification, failure or refusal to comply with a company directive, including refusal to participate in company investigations, misuse of any company benefit or perk, being under the influence of any intoxicating substance while working and circumventing an established work protocol. And then it just tells you, and I'm sure that you all have something like this in the beginning of each of your, in each human resource manual or resource policies and procedures. That's one part of your code of conduct. It's basically everything you've learned in kindergarten. Say please, say thank you, treat everyone with respect, don't take what isn't yours, share, all of the things that we learned in kindergarten, most of those still apply. But if you don't have a code of conduct, you need to write one to have a portion of the compliance plan done. Now, we're going to move to the risk assessments. And you know, one of the key things on the risk assessments is to find compliance areas that concern the organization the most. It's based on the type of services. And when I read these things, is that I'm sitting here going, I think as I said last week, is it's like saying to someone, you need a financial plan for your financial future. I have no idea where to begin. I have no idea what that means, but I know I need one. So one of the things that we did was we sat down and we said, we're going to look at some areas and see which ones are going to hurt us worse if we're not doing it. And so I'm going to come right here and just show you that's what it says. It says conducting internal monitoring, implementing practice and standards and responding to, conducting training, and enforcing the standards. The risk assessment, we picked, and I keep saying 5 areas, but we actually picked 6. The 5 that we picked is that you have your conditions for coverage. The 19-page questionnaire that we talked about, the 19-question questionnaire that we talked about last week that's on the HRSA website, there are specific, you must do these. And I remember some of them, which is that annually you're supposed to see whether or not you're still meeting your goals. You know, one of them is that for your physicians and your practitioners, you're doing primary source verification of credentials. So these are 19 questions, and they're just simply yes, no. Now, the reason we picked these as risk areas is because if you don't meet the conditions for coverage, you cannot exist as an organization. And we figure that's pretty important. The second thing, the 340B program, is compliance with the requirements for the 340B program. The 340B program, which is the pharmacy program, is under extreme scrutiny because the pharmaceutical companies don't like it, and hospitals and FQHCs are using it, and so we know that they are looking at that and looking at the 340B compliance. And one of the things on 340B compliance is that they have to be seen, and I know this one as a fact, they have to be seen by you before they qualify to use the 340B program. So one thing that has to be done, and this would be a compliance type issue, is if someone comes and looks for a prescription, do we have them in our patient master index, and have we seen them before? And if we have not, then they don't qualify. So those are the types of things that you would have as a policy procedure. Says before you issue a prescription, you will make sure that that they are actually registered as a patient. Now, why would we write a prescription for somebody on a 340B program that was not a patient of ours? Well, we do. Somebody comes in that we know, and we get the doctor to write a prescription, and lo and behold, next thing you know, they're wind up in the 340B program. Human resources, compliance with the requirements for FQHC personnel, financial relationships, and those are the Stark laws, and making sure that our relationships with our physicians and the contracts and the independent contractor agreements that we have do meet all of the things that make them adhere to the Stark laws. And there may even be a thing called Sarbanes-Oxley laws, which are primarily for bank and business, but someone has to review that. And as a compliance officer, you would set those up and say, we're going to review these frequently or infrequently, or how frequently we're going to do it, and so forth. Data integrity, which is HIPAA, is the maintaining the patient records. I may have mentioned I went to view a physician practice the other day, and I said, well, how do you transmit the information? Well, come to find out they're using an intranet, which has absolutely no security on it, so they're passing information back and forth, and they're using their own emails and sending patient information and so forth and so on. So we told them they need to stop that. They got the guys in, and so lo and behold, we were able to do that. The medical record and chart data integrity, and that is, everybody hates this, is billing and coding and documentation, is to make sure, and I know that you all are paid differently, but nonetheless is that if you're being paid for an office visit, then what happened during that office visit should be documented, and it should be documented legibly and neatly. And I'm teaching a 5-hour course tomorrow on how to document, but it's important you do that, and then also is to making sure that it is billed correctly. Again, I keep finding things that are near and dear to my heart. We just found out that on one of our physician practices that we work with, is they were billing all of their documents, all of their charges, as though they were clinic. Well, he's actually a radiologist. He's actually a radiologist, and we found out that we're billing all of those for the codes for the clinic instead of for in a facility base. So we were overpaid, or he was overpaid. We are these questionnaires, is that we got the questionnaires relative to each areas, and as we go through them, we are going to make sure that you get the questionnaires before we do the meeting, so the conversation, so that you can then be pretty well aware of what's going on before we even do that. To do the assessments, the main thing you need to do is as a compliance officer, is to give them to people and make sure they know when they're supposed to get them back. There's no correct answer. There is only an answer on these questions, yes or no. And it doesn't matter from this assessment standpoint of what the answer is. What it does is it leads, the no questions lead to something that we're going to be able to work with the compliance officer to get it corrected. Okay. One of the other things they talk about is the compliance hotline, which is one of the open lines of communication. And here's just some things that you need to know about that. It is confidential. You should not talk about whatever happens. Check it frequently and keep a log, so that when you go to the compliance committee, is that you say, we received 15 calls, 14 of them were hang-ups, and one of them was to complain about they weren't getting paid enough. Investigate all calls, then you use it to, and frequently, as we were just saying, is that a lot of those hotline calls are personnel problems, I'm not being treated fairly, and so forth. Well, then you go and investigate those issues with the human resources to see if there is some smoke or there's fire where there's the smoke. And then never, ever, ever discourage anybody to use from using the compliance hotline. Even if you get some of the strangest calls in the world, just let them come. And then we sent out, I think, Christine, we sent out, and it's in a publisher format. This is a thing that you can do. You put your name, you put your number and the extension number here, and just put those up in your organization, and you've established a compliance hotline. You just need to have somebody come to it and open it up and make sure that that we're answering those calls. And as the last slide, I always put those things. Here are some resources that you want to look at for these things. And I think the next steps is to look at in appointing a compliance officer, establishing a coding hotline, review the compliance guidance, review your compliance plan, and review the areas of race, perform the gap, and establish a code of conduct. Now, we set these things monthly, and we're doing this in little chunks because if you do this, it's going to about take you a month to get a compliance officer set up so that they know what they're doing, and then we'll be moving into the next things over the next few months. And I think with that, I'm done, and we should have about maybe 15 to 20 minutes for questions.
Thank you, Bill. That was really informative. At this time, if you would like for me to unmute your phone, you can raise your hand in the box provided, and I can do that, or the questions box is also available for written questions. At this time, we don't have any submitted, so we'll give it a minute or so.
That's scary that no one has questions. This means that I either did it very well or I did it so poorly as everybody says I have no idea what to ask. Well, let me ask a question with a show of hands. How many of you all have a designated compliance officer?
Four attendees are raising their hand.
Good. Okay, that's cool. That's
and one question has just come in. Is it recommended to have vendors and suppliers sign the code of conduct?
No, they don't. They need to know your code of conduct, but I don't think you would have to sign it. But in your contract, they should have a code of conduct as well as they should have a business associate agreement with you. But you know, making them aware that in the contract it says that they will, and then if they want a copy, provide them with one.
Okay, thank you, Bill. It looks like we don't have any additional questions, so I'd like to thank everyone for attending the presentation today. And as a reminder, the next session of the Institute will take place on May 25th from noon to 1 o'clock Central Time, and the May meeting will focus on conditions of coverage. If you are still in need, you should have received, if you registered for this webinar, you should have received the presentation handouts. If you have not, please feel free to reach out to me at cforstner@lpca.net, and I would be happy to send them to you after today's conclusion. Thanks, everyone, and have a wonderful day.
Thank you.